Total parenteral nutrition. Topics to be discussed are indications, composition, administration, complications, and contraindications. Generally, parenteral nutrition is of two types. One is supplemental, another one is total. In supplemental, we give the parenteral nutrition along with enteral feeding. Whereas in total parenteral nutrition is the sole source of nutrition. Okay, so the parenteral nutrition is delivery of nutrition through IV in whom adequate feeding through alimentary tract is not possible. Indications. They are short bowel syndrome, intestinal fistulas, postoperative anastomotic leak, hypercatabolic states like sepsis and polytrauma, and if anticipated period of NBM is more than 7 days, like in critically ill patients, inflammatory bowel disease exacerbations, etc. Coming to composition. Composition, it mainly contains four things. One is lipid emulsion, amino acids, glucose, and micronutrients. Lipid emulsion, they contribute nearly 30% of total calories. Glucose, it is present in the form of dextrose, whereas micronutrients are electrolytes, trace elements, and vitamins E, T, B. Amino acids, they are essential amino acids and non-essential amino acids. It contains all the amino acids except for two things. They are arginine and glutamine. Composition can be changed based on the patient needs, especially the protein requirement differs. In a normal patient, the protein requirement is 0.8 to 1 gram per kg per day, whereas in critically ill, we have to increase to 1.5 grams per kg per day. If the patient is on hemodialysis, we increase to 1.2 to 1.3 grams per kg per day. Whereas in patient with acute hepatic encephalopathy, we uh, there will be a temporary protein restriction to 0.8 grams per kg per day, and we also decrease to 0.6 to 0.8 in case of chronic renal failure. Along with them, we can give some supplements like folic acid, vitamin B12, and phosphate. Folic acid we give once or twice per week. Vitamin B12, single dose, and phosphate 20 to 30 millimoles per day. Next, administration. There are two routes. One is central venous catheter, another one is peripheral venous catheters. Central venous catheters, they terminate in the superior vena cava or right atrium, and there are three ways. One is peripherally inserted central catheter, central venous catheter, and an implanted port. Peripherally inserted central catheter, there are four veins: basilic vein, cephalic vein, brachial vein, median cubital vein. Among them, basilic vein is most commonly used. For central venous catheter, we can use internal jugular vein, subclavian vein, femoral vein. Femoral vein is avoided usually due to high risk of infection at this site. Whereas implanted port, it is Hickman's line. It is implanted under fluoroscopic or ultrasound guidance. It is a device that is implanted under the chest skin with a catheter inserted into the superior vena cava. All the parenteral nutrition bags, they should be covered at all the times, even during infusion, to prevent the vitamins from degradation. Complications. There are insertion related complications, line related complications, metabolic complications. For insertion related, there are two: pneumothorax and misplacement. The most common pneumothorax is most common after insertion of subclavian lines. Whereas line related and misplacement, the correct position of the line is usually if the tip is at the inferior one third of the superior vena cava or at atriocaval junction. So we usually take a check X-ray after placement of uh, catheter. Line-related complications are sepsis and thrombosis. If sepsis is suspected, then we should stop using the line and paired blood cultures, that is from the line and from a peripheral site, they should be sent for culture and sensitivity. If it is positive, then we remove the line and use antibiotics based on the culture sensitivity. For thrombosis, the treatment is anticoagulants, and we can prevent the thrombosis by regular flushing of the catheter. Metabolic complications are refeeding syndrome, blood sugar derangements like hypo or hyperglycemia, and mainly seen in diabetics, and liver dysfunction, metabolic bone disorders like osteoporosis, osteomalacia, vitamins excess or deficiency. Contraindications of total parenteral nutrition are in infants with less than 8 centimeters of small intestine and in irreversibly decerebrate patients, cardiovascular instability, metabolic instabilities, and when GI feeding is possible, then TPN is contraindicated. Thank you.